Today is World AIDS Day, a day set aside to raise awareness about HIV and AIDS, to show our support for persons living with HIV, and remember those who have passed. The theme for this year's observance is End Inequalities, End AIDS, and End Pandemics. This theme highlights the importance of addressing economic, gender, racial, and social inequalities. These inequalities have prevented persons at risk for HIV from accessing prevention services and those infected from accessing care and treatment services. These inequalities have driven the HIV pandemic, with 1.7 million people getting infected, while 690,000 have died. Of the newly infected, 62% were from key populations and their sexual partners. Despite the COVID-19 pandemic's challenges, which has disrupted health services, the government of Guyana and its partners have worked to end inequalities and increase access to prevention, care, and treatment. This has resulted in 9,022 persons being diagnosed with HIV, while 6,573 persons are on treatment, and 4,052 are virally suppressed. Of growing concern is that many HIV-positive patients are hesitant to be vaccinating, putting them at risk for COVID-19. Nevertheless, the Ministry of Health encourages vaccination for these patients and has conducted several informational sessions with various key population groups. We are hopeful that more HIV-positive persons will get vaccinated soon. The Ministry of Health continues to roll out combination HIV prevention by complementing HIV education, condom distribution, self-testing, pre-exposure prophylaxis, and post-exposure prophylaxis. The Ministry of Health is committed to closing the gaps in the testing and treatment cascade by increasing access to testing through self-testing and working with partners to offer VCT in all regions. In addition, the government has secured enough ARVs for all patients needing treatment and taking steps to reduce loss to follow-up by employing multi-month drug dispensation, using new and effective combinations of ARVs, and using DOTS in HIV management. In addition, many patients have been screened and treated for STIs and hepatitis. Plans are already on the way to secure treatment that cures persons with hepatitis C. The Ministry of Health has been working with several community-led initiatives to expand prevention, treatment, and care. We are optimistic that these partnerships would help us reach more at-risk groups to enlist them into our programs. Work is also ongoing to strengthen rights-based approach by working with stakeholders to remove discriminatory laws and other policies that can create structural and social barriers to prevention, care, and treatment. The details of these and other plans are outlined in our HIV/AIDS 2021 to 2026 strategy. While much has been accomplished over the past year, there is still much more to be done to close the testing and treatment cascade gaps and remove legislative barriers to prevent inequalities. On World AIDS Day, we say a silent prayer for those who have died from this dreaded disease and recommit ourselves to reducing new cases and ensuring that those who have tested positive will receive adequate treatment to ensure that they remain virally suppressed. Together, let's end inequalities, end AIDS, and end pandemics now.